Hello, everyone. I hope all is well. My name is John Edmonds Ford, and today I will be presenting on the efficacy of cognitive behavioral therapy. Okay, so first and foremost, what is cognitive behavioral therapy? Cognitive behavioral therapy is one of the most widely used forms of psychotherapy. It focuses on a couple things, which is to identify and change negative thoughts, beliefs, and behaviors that you may have towards yourself. Okay, so it can also be called CBT, which is still cognitive behavioral therapy, and it was created in the 1960s by Aaron Beck. And it has two main goals. The first goal is to reduce emotional distress, and the second goal is to help develop long term coping skills that may improve daily functioning and the quality of life. Okay, so I reviewed two articles. The first article that I reviewed is by Kuchbers and colleagues from 2013. This research is a meta analysis focused on how effective CBT is in treating adult depression. A meta analysis combines results from many different studies to provide stronger evidence. Okay, so now we're going to go into the data of Article 1. This study included hundreds of randomized controlled trials, which are considered the gold standard of research. And by meaning the gold standard of research, which is the peak, the high point of research, like, you know, if you research something that's and you're doing an experiment, that is something you want to focus on. The randomized controlled trials. The research compared CBT to control conditions such as waitlist or usual care. So waitlist and usual care are the things they were using CBT to control. Um, Also, they then measured the depression symptoms before and after the treatment. The outcome of Article 1. Okay, so the results showed that CBT led to a significant reduction in depressive symptoms. It worked well whether given in a group or individually. Importantly, people continued to show improvement even after treatment ended. Based on this, the authors concluded that CBT should be a first line treatment for adult depression. Okay, so this is the second article, and we're going to touch on this article. The second article I reviewed is by Hoffman and colleagues from 2012. This is also a meta analysis, but there's a catch. This one focuses on anxiety disorders such as generalized anxiety, panic disorder, and social anxiety. The data that was collected from this article, which was this study, included long term follow up data from many trials of CBT. The researchers tracked anxiety symptoms over the years to see how lasting the improvements were. Okay, so the outcomes of this article. The results showed large clinical improvements in anxiety symptoms, even up to 5 years, which is like a drastic like duration after treatment, that these benefits were still maintained. Relapse rates were lower than those seen with the medication alone. The study also noted that CBT can also deliver in many formats, which includes computer based programs without losing effectiveness, is what they would call it. So we did a comparison and an analysis between both articles. So, first, both articles clearly support CBT as a very effective treatment for depression and anxiety. They show short term improvements and long lasting benefits. However, Both studies also mentioned that CBT might not work perfectly for everyone. So, yes, it is a widespread and a very much used form of psychotherapy, but it might not work for everyone. Just like certain medications might not work for every patient in a hospital setting and that for and etc. Um, public excuse me, sorry about that. Publication bias may exist, and treatment success can depend on the therapist and the client's engagement. So lastly, the conclusion and final remarks. So in conclusion, CBT continues to be a gold standard treatment that is supported by strong scientific evidence. It has many benefits to prove that it is the gold standard, such as it helps individuals better understand their thoughts and behaviors. And secondly, it gives tools that they can use throughout their entire lives. This research shows why CBT remains one of the most effective psychological treatments that is available today. And most scientists say that most medicine or medications isn't needed because CBT is what can help you. These are my references of the two articles that I used. Once again, my name is John Edmonds, and thank you for listening.